I'm Emily McElwaine and I work for Somerset Foundation Trust, and my job role with them is Practice Educator in the radiology department. It's an absolutely great way of getting into diagnostic radiography. It's a really hands-on job. So to be able to have such hands-on experience over the 3 years of your training is absolutely brilliant. And obviously I appreciate for a lot of people who've maybe studied before or are mature and have, worked for a few years, don't necessarily want to go back to university to do the undergraduate programme. So for them, being able to carry on working and being paid whilst they train, is a huge plus. It's not an easier route in at all, and there is still the same level of academic content required. So the guys who've been on the apprenticeship, who are working 30 hours a week, are still having to do an awful lot of hours of academic study as well. But we've just made sure that our apprentices were really supported with that and given the time that they would need. So they would have a protected study day 1 day a week, and then on top of that, any additional study time that they felt that they needed before assignments were due to be handed in. So I think it's a fantastic route in. The apprentices that we've had that have gone through, who are really highly clinically skilled due to the just sheer volume of hours that they've done during their training. So yeah, it's a great route in, and it's really good for us to have a different route in as well. So it's not just the undergraduate programme, like I said, opening it up to people who've maybe studied before, or going to university just isn't an option. So with the apprentice programme, we have currently been using the University of Exeter because we do already have close links with them and a good relationship, having used their undergraduate programme, and their entry requirements are really very similar to their undergraduate programme. So you have to have your GCSE English and Maths, and that needs to be a grade C or above. So if you've got functional skills, it needs to be functional skills level 2. And then also there needs to be some sort of education, further education at level 3 study, and that can be in a science subject or a healthcare subject. So what I was saying earlier with regards to people who have potentially come back to study, having had a break, if they haven't got the required entry requirements, there is courses on offer. Somerset Centre offer them their access to higher education. There's access to higher science, or there's access to healthcare. University Exeter recommend that you do the access to science. The main reason for that is that diagnostic radiography is a really science heavy based degree. So there's a lot of physics and a lot of biology. So the access to science just gives you a little bit of a better step up into it. All applicants would need to have some sort of work experience in a diagnostic radiography department. So we recommend a minimum of 2 days. And that's just because, we don't want there to be a high attrition rate from the programme. We want people to know what they're signing up for. And so then they would need to find a job role, a job vacancy within a trust. So for example, we advertised for an apprentice, and then if you are successful at interview with us, you then apply for the university course. And then you would get accepted onto the university programme, and then you'd be enrolled from there. But you would be a full member of staff for Somerset Foundation Trust. So we look after all your hours, annual leave and things like that. Apprenticeship absolutely sets them up to hit the ground running as Band 5 diagnostic radiographers. They, over the 3 years that they do the programme, they get all of the academic skills that they require, but they get all the clinical skills that they require as well. So it means that upon completion of the apprenticeship, they can apply to the HCPC, which is the Healthcare Professionals Council, for their registration, and then they can work as diagnostic radiographers at a Band 5 level, which means that they are classed as practitioners, so they're justifying their own x-rays, and they're taking their x-rays, making sure they're happy with their imaging, and sending them and archiving them properly as well. So it really is a well-rounded apprenticeship to get you the ultimate goal of being a diagnostic radiographer at the end of it, with, like I said, really strong clinical skills due to the large, the sheer volume of hours that they've completed whilst they've been doing the apprenticeship. For me, I've really enjoyed watching them, supporting them, help them. We had COVID, which happened pretty much as soon as they started. So it was finding new ways to make sure that they were still remaining skilled, obviously with a decreased workload, and also keeping them safe at the same time. But having them as staff members meant that we could offer them all the training that we got. We could make sure that they were fit tested and vaccinated and all the rest of it. They were obviously given the same opportunities as the staff. So yeah, from my point of view as a practice educator, it's been really good to see two people who have been really dedicated to it, worked incredibly hard to be successful at the end and to have graduated.